Hello, my name is Adolis Esteves Ramos, and this is my presentation on language barriers in healthcare. Globalization means more people move around the world for work and educational opportunities. Imagine facing a medical emergency and not being able to convey your symptoms or what brought you to the hospital. This is a devastating reality for millions of US citizens. According to the 2016 census, 35 million US citizens over the age of 18, or more than 15% of the adult population, speak a language other than English at home. Language barriers can prevent patients from engaging in conversations with their clinicians. Numerous studies conducted over the past 30 years show that a clinician's ability to explain, listen, and emphasize can have a huge impact on a patient's health outcomes as well as patient satisfaction. Language barriers can result in miscommunication that impacts a patient's understanding of their condition or treatment. This can potentially be life-changing or even life-threatening. Language barriers between health professionals and patients increasingly affect patient care. In the United States, a language other than English is now spoken at the home in 1 of 5 households, the highest level since just after World War I. Patients with limited English skills are referred to as patients with limited English proficiency. The largest group of migrants in the past 30 years speak Spanish, with only 5% of US nurses identifying as Hispanic or Latino. It's very common for patients in this group to encourage a large language barrier. In 1964, the U.S. Civil Rights Act helped ensure that a lack of English language skills wouldn't be a source of discrimination. U.S. law requires that healthcare organizations provide interpreter services to patients with limited English proficiency. Evidence shows how language barriers impact patients' outcome in healthcare delivery. Patients with limited English proficiency have longer lengths of stay than English speaking patients, even if they have a higher socioeconomic status. They also have a higher risk of 30-day readmission by as much as 25%. Properly trained interpreters play a crucial role in healthcare. Many healthcare providers use both in-person as well as over-the-phone translation services to get help from an interpreter. Additional access to tools such as translation devices apps is priceless. This has been tremendously helpful during the current COVID-19 pandemic, where the minimum amount of personnel in a room is crucial. For clinicians whose time is already scarce due to growing pressures on healthcare organizations, interpretive services are life-saving. Medical interpreters have a professional code of ethics that binds them to the same patient confidentiality requirements as every other healthcare team member. Most interpreters hired by healthcare organizations have undergone some kind of medical interpreter training because of healthcare has its own language. Having clinicians who are bilingual is also increasingly helpful for healthcare providers hiring more bilingual staff. Not only can they translate important information to patients, but they can also help their organization communicate in a way that takes cultural differences into account. Often, family members are the first to aid in interpreting. While this can be helpful at times, it possesses the higher risk of misinformation and miscarriage for a patient. Regulations implemented as part of the Affordable Healthcare place new restrictions on the use of family members and validating language skills of healthcare workers. Other ways of overcoming communication barriers include encouraging clinicians to be more visual and make full use of visual prompts. Patients are more likely to remember and understand information much better with clearer visual prompts like diagrams, images, and models. Ultimately, healthcare providers must use a combination of the right people and translation technology to remove communications barriers and improve clinical outcomes for patients who do not speak English as their first language. And that concludes my presentation on language barriers in healthcare. Thank you.